So last night I was scrolling on YouTube and I came across a chiropractic video where they were popping this girl like a piece of popcorn. And I just want to know the difference between that type of chiropractic work and the work that you do here, and what are the benefits of yours?
Actually, it's totally different. I think the best way to get into it is when I first got out of chiropractic school about 21 or 22 years ago. I used to do old school chiropractic, as I call it, where the bone's out of place, push the bone back in place. That makes sense to me. If your structure's more in alignment, it's going to function better, move better, and there's health benefits that come with that. The challenge was, despite me trying different techniques and applications, to get more sustainable changes, what I noticed is that it wasn't always sustainable. Actually, most of the time, the structural change is not sustainable. And the person would have to come in for repeat visits the vast majority of the time. So I'm one of those annoying students that always kept asking why. Well, why is it the person got a great adjustment, her headaches went away, her range of motion was better with her neck, but yet she had to keep coming in to some extent with repetition in order to sustain that. So the obvious question is, what's being missed? And that's when I got exposed to network care. And network care helped me understand that it's not really the bone that needs to be moved, it's all the tension behind it. And if we could do something to help the person experience the energy or tension behind the vertebra and release that stuck energy, that stuck tension, that stuck emotion, whatever it is, then the vertebra unwinds by itself as the person heals whatever wound that is. In other words, your issues are in your tissues. And the structure, yeah, no, I like the way that rhymes too. And the interesting thing about it is the understanding that it's not the vertebra being out of place that's the problem. It's the person not able to experience the experience fully. And what I mean is, let's say someone has a horrible event happen. They had a loss of a loved one, or they got humiliated or embarrassed. Well, that emotion is so much for the person that they can't fully deal with it. So what the body does is it says, you can handle this much, but you can't handle all this. So what we're going to do is allow you to experience what you could experience, and this that's left over, you're going to internalize, right? That makes sense to a lot of people. Like they get
It's like
that.
throwing it in storage.
Yes, you're throwing it in storage, and it's like a safety mechanism where your body, your subconscious is protecting you, saying, hey, you can handle this much, but you can't handle all that. So we're going to take what you're not able to digest in the moment and internalize it so that you're going to store it until a later date when you're out of that situation. And then maybe you can revisit it and resolve it, going through walking or doing yoga or doing meditation, whatever it is, where you could digest and recover. But the challenge is that as your body's making room for that package of energy or that emotional experience that was too much, whether it's in your pelvis, whether it's in your neck, your upper back, your shoulders going forward, however your body's making room to store that undigested life, for most people it ends up becoming a chronic habitual thing. And whatever you do often, you do best. So if someone disassociates from that area and they continue to do that over days and weeks, well, before you know it, it's a pattern and they never fully deal with it and recover from it. So they become dependent on getting the massage every week, the physical therapy every week, the chiropractic every week, the stretching every week. But if you look at the growth, they'll reach a certain plateau, and then after that, there really isn't much more growth. And the reason why is because it's not the bone, it's not just the tissues, it's the energy, the emotion, it's the trauma they're storing that needs to be resolved so that the body can fully release that on its own. And then that's not only more sustainable, but from what I've seen, it's more impactful for the person's quality of life. Because I think we'd agree, if you stretch so much, you're like a pretzel, you can put yourself in one of those little boxes like from Cirque du Soleil or something. Well, if you keep stretching, you keep doing that, but you don't fully get with the emotion that you're storing, your body will keep losing that range of motion. Your body will keep going into that postural distortion. So again, the end result is to help the person get the gift and the experience and move forward. So what can we do to facilitate that? And that's everything that we're trained to do with network care and the somatic respiratory integration, or the consciousness exercises, as I call them. Experience the experience so your body can get the gift and move on. Otherwise, it's destined to repeat.
I actually never knew the difference. Now I know.